Welcome to Grit City Tales, a podcast brought to you by the Humane Society for Tacoma and Pierce County. I'm Mary.
And I'm Maggie.
And together we're amplifying the untold stories of pets and the people who love them right from Pierce County, Washington. Welcome, everyone.
Thank you for joining us. Well, today is going to be an interesting topic. Some of you may have seen information about our Mobile Veterinary Unit this past week, and we wanted to invite one of our shelter's experts on the topic to go over what a mobile unit is, what is it going to do, how it's going to help our community. So let me introduce Dr. Bennett. Please give us a little bit of background about yourself, your role here at the shelter, and then we'll dive into talking about the Mobile Vet Unit.
Thank you, Maggie. Thank you, Mary. Thank you for having me. This is fun. I'm Dr. Jennifer Bennett. I'm the Chief Veterinary Officer here at the Humane Society of Tacoma and Pierce County. And I have been with the Humane Society for about a year and a half and have previously worked with the Humane Society as a relief veterinarian and have known of your organization a long time. So now that I'm a part of it, I get to oversee the veterinary team and the foster team and work collaboratively with many of our operations teams that oversee all of our animal care and animal services.
Yeah, that's a hefty job, right there.
Yeah, That's no light undertaking, that's for sure, especially with as many animals come through the doors any given day, which we'll talk about that in a little bit as well.
Yeah, definitely going to talk about that. And we want to discuss how this mobile veterinary unit will support our operations and support maybe new programs or existing programs.
Mm-hmm.
And so can you tell us a little bit more about what exactly this mobile unit will offer us?
Yeah, well, first, just to describe it, a mobile veterinary unit is sort of a big fancy word for a vet clinic on wheels. So if you picture an RV, this is a 26-foot vehicle that we have selected as a design that meets our needs. And it's basically a clinic fully serviced on wheels to be able to provide spay and neuter surgery or any surgical procedure, to provide examinations and treatment space, and also can be used even as a mobile adoption unit or a mobile vaccine and wellness clinic.
Wow.
So it's quite versatile and quite literally expands the walls of our shelter anywhere we can take it.
And we need that right now. That's for sure.
We definitely do.
Our
Wow.
community is showing us that with all the inquiries we get every day, and then just the limits to what we can have here in the shelter.
Our physical capacity.
Yeah.
That's right. It literally expands the space in which we're performing these services, but it also reduces a lot of barriers for people being able to receive those services. The first one, obviously, that comes to mind is transportation.
Mm-hmm.
If they can't come here, we can go there.
And you know how many counties we service, all the way out to Edgewood and Eatonville and,
A Lake Bay on Key Peninsula.
Right.
I was out there last week talking to a school.
And there's so many other counties that need to be serviced that can't make that drive all the way down here.
That's right. There's actually what we call veterinary deserts, which are areas of non-veterinary service. And one of the closest ones to us just exists between South King County and Thurston County and out to the borders of Pierce County. So
Like Spanaway, like Parkland area.
Yes, Spanaway. And so there are many areas that simply don't have services there, even if people are interested, willing, or able to pay for them.
Especially not low cost services.
That's right.
Well, and out in kind of the outskirts, I would imagine bus transportation is also a bit tricky for people. So even if they have kind of access to public transportation, even that is not necessarily nice and close by for them.
And keep in mind that not all those transportation options will even allow pets with their owners.
That's true as well.
Yeah.
So for our upcoming mobile veterinary unit that's in the works, can you tell us a little bit about what equipment or features ours might have?
The bells and whistles.
Yeah, what are the bells and
Absolutely.
whistles?
Well, this is the fun part, is picking out the unit and picking out what the unit will have on board and what it'll look like. So in this case, the mobile unit we selected is a moderate size. We have to be able to drive it. We have to be able to park it. We have to be able to maneuver it. And it's going to have spaces, as we mentioned in the beginning, for exam space, treatment space. So it will have an exam table, it'll have a scale in there, it will have overhead lighting that's specific for exams and surgery. Then in the back of the unit, it actually has a separate surgical table and a separate sliding door to create 2 spaces. And in that surgical space, there is an oxygen concentrator and a vaporizer, an anesthesia machine. Those are all the things that deliver the gas anesthesia to the animals under surgery, and to be able to have those in a small space. In the other front part where the examination area is, there are other pieces of equipment that we need. So an autoclave, which allows us to sterilize the instruments that are used for surgery right there on site, as well as a sink for wet procedures, and storage, and of course housing for all the animals both before and after that are recovering from surgery.
Oh, well, I was just going to say there's a diagram, I believe, like an overhead, very basic diagram, but for those interested,
Yes.
that's on our website, actually. And I was wondering what those different pieces were.
I'm excited.
Yes.
So, yeah, please continue.
Yes, a bird's eye view is kind of the easiest way to picture this, and I think that's what our diagram represents. And so there is room up front to drive the vehicle like you would a traditional RV, and everything else is fitted inside. And so once it's fully outfitted, it's tightly packed, but everything has a place and everything has a function. One of the other features I was going to mention is that we did do 2 additional options on the outside of the vehicle. One is a 16-foot awning that will come down from the side, which is great in our county. Whether it's rain or shine, we can perform services, and it expands the area in front of the mobile unit that we can still have tables and services happening in front of the vehicle, and of course some climate control. And then the front side of the unit actually can roll up to reveal the cages and show the animals inside. We can actually use it as a mobile adoption unit, and those animals can be viewable as they would be here in the shelter. So if we want to take an adoption unit to a place that doesn't have a building, we can actually use it that way as well.
I'm thinking that fresh, crisp P&W air would be so nice for those animals.
Yeah.
And especially with our weather here.
So perhaps we could
great.
attend a community event or a park event, right? And we can roll up with a mobile unit full of adoptable animals and create an event right there on site.
I'm sure
sounds lovely.
The external adoptions coordinator would love that system more so than she's been doing a few events, education and adoption events, but she does adoption events also off-site. And it's definitely a process loading up everything she needs in one of our smaller vans.
A lot
and
of planning.
Loading up the animals and then having to set everything up once she gets to whatever site. So having a fully contained little unit to take all the animals, I imagine that will be really great as well.
Yes, and it greatly reduces the stress on the animals too, right? Because now they are having less transportation in and out of unfamiliar areas. Once they're in there for the day or for the whole time of their spay-neuter or for the time of the adoption, and they're not getting transported in and out of multiple cages and kennels.
Yeah.
So the less movement we have to do, the less stress, and typically the less sick or upset they'll get.
Yeah, my mind's going to, I know we've talked about it on the podcast before, our vaccine and wellness clinics that we host right outside our building. And, that's a barrier for some people. They can't travel to that clinic. And so I'm thinking, wow, off-site clinics.
That's right. Yes. So again, it's a hospital on wheels, so we can take it. If we can get there, we can take it. And it's also just a safer option even for the clinics we're doing right here on site. I know we've talked a lot in the past about how weather and temperature has affected those clinics.
Yes. There have been some cold clinics so far.
Very cold, and we're coming into perhaps very hot clinics, right?
Yes.
And so having the ability to have climate control, I will mention this unit has a bathroom and air conditioning.
No way.
Both things that are going to be very popular with the humans that are going to be in this unit.
The vet team is going to be so
That's right.
excited.
They're going to be fighting to get on there.
And will definitely sustain us for long day operations, wherever we go. So that's exciting because those creature comforts are really not just for the animals, but for the people that are working on these units.
Which you have long days when it comes to surgeries and events. And let's talk about the our goal of the unit specifically with TNR, targeted TNR in the community.
You'll be going anywhere and everywhere, I would imagine, right?
That's right. But as Mary said, targeted is really the key. So let's talk a little bit about what that means.
Yeah, that'd be great.
So TNR means Trap-Neuter-Release or Trap-Neuter-Return, as it's sometimes called. And so that is a term specific for community cat populations where there are programs that will have the goal of trapping these animals, spaying and neutering them, and then putting them back where they're found found in their community where they already have homes and are already being cared for. And so targeted in front of that, so the targeted TNR phrase actually means that there is careful planning that goes into where we go in and where we trap colonies and how we count those cats. And research has shown in these programs nationwide that that's really the best way and most efficient way long-term to make a difference in the community cat population, as opposed to allowing people to randomly trap and bring them in or just finding them wherever you are. And so it's actually quite very narrow. When you look at the targeted programs, you're typically only talking about a couple of square miles that are identified with several cat colonies, and you'd go through until you get reduction in the numbers to where your targeted percentages is, and then move on to the next place. So you can spend a fair amount of time in one small targeted area.
How do you find the colonies? Is it talking to the community members like the Cat Illuminati told us, like just walking the blocks and finding where the cats are? How will you go about that?
Part of setting up this program will be to develop the volunteer base with a coordinator who will start to have community conversations. People who are caring for these colonies know where they are, and so letting them know what services we're going to offer and having them help us identify the best targeted locations is going to be the groundwork for this, literal groundwork, walking the ground, letting them know what we're there and what resources we're offering and how that's going to be performed. So back to the use of the mobile veterinary unit, the initial priority is to use it for targeted TNR days where once we have those colonies identified, we'll go in and try and reduce the numbers through spay-neuter. And then we will obviously have other days where it's not in use. And so we'd like to use it in some of these other ways we've talked about. For our monthly wellness clinics, it's obviously a safer space to have small dogs or cats contained than out in the parking lots. For adoption events, and also it can service dogs in need of spay-neuter services as well.
Yeah, and I know maybe some of y'all listening are hearing, we're going to come into the community and take cats and spay and neuter them. Well, like Dr. Bennett said, it's going to be about conversation and talking with the people that are caring for those colonies of cats. Most times, people that take care of those colonies of cats know that, they're reproducing and they want to get help for those cats, but they don't know how. Most of the time, it's reaching out for resources and trying to trap them. And if we go to them, that would reduce a lot of the barriers to helping those colonies.
Well, yeah, these people in the community are doing the kindness of looking out for those animals, but they don't have the money to have, if you have a colony of 20, 30 cats running around your neighborhood.
That's a lot of food.
That's a lot of food. That's a lot of vaccines. That's a lot of spay and neuter services.
And it can get out of control fast.
Yeah. I mean, we're seeing it now. All of the people finding litters of kittens out in their communities right now. Sometimes they're able to get mom, sometimes not. And if those moms and dads are out there still reproducing, it's just a never-ending cycle of all these kittens being born out on the streets and being faced with, upper respiratory infections and whatnot. It's not an ideal environment. So keeping them from reproducing is really important, but also checking the health of those adult cats that are out there in the community as well can reduce just the strain on the people that are caring for them and the ones that ultimately end up at the shelter because people are finding them.
That's right. It really is about keeping those populations healthy. And every time we have the opportunity to have hands-on a cat in these situations, we're going to be doing a physical exam. We're going to be seeing if it needs treatment that we can handle in that moment while it's there for spay-neuter services. If it looks like it's thriving and doing well and can go back in where it is, where it's been found and where it's been thriving. Occasionally you'll find ones that are not doing well and they're struggling and they're not appropriate to put back in, and we can provide compassionate care for them as well. And so it is not about changing the caretaker colony relationship. In fact, it's about helping them to do more for those colonies than they've been able to do on their own. Yeah. And that's really the message is here's an additional tool for you to help care for your community cats. Many people see all of the community members as the cat caretakers, right? They're not just one person, but many people that are invested in them.
Yeah, playing a supportive role.
That's
in
right.
The relationship that they already have with those cats.
And really being a community resource center. So it may be, as you mentioned, providing food sources for them, providing vaccine resources, spay-neuter, of course, is how we would use the surgical suite. And then just information. There's a lot of education around community cats. Many people still think that that means the cats are feral, which we often will think of as not friendly or not touchable. But in fact, many of them are people adjacent or people friendly, as we say. They maybe want to be near you but not be picked up, or they may be completely friendly, but they don't live indoors. They live in a community and they roam around and know where their resources
from
are.
house to house. Yeah, they
That's
make
right.
friends wherever they go.
They get 5 meals a day instead of 1.
He was mentioning that, and a lot of his work is involved with trying to spread that as well, because some people
Yes.
find these friendly cats and think they're strays, and they take them from their community that they've been living and doing well, and everyone knows them, and then they're brought here. They're kind of like, whoa, I was just out having a nice walk, and now I'm in the shelter.
What the heck?
That's right.
And a lot of those cats don't end up being returned to owner because they don't have an owner.
They don't have an owner,
owned.
or we don't have information about where they came from.
Right.
If it didn't come through a channel that we were able to gather address information. The important thing with TNR programs is that once cats come through the program, they get an ear tip. And that is the signal to you as a community member that that cat has already been trapped, it's already been cared for, it's already been spayed or neutered, and it is back doing well in its community. So it does not need to be trapped again, unless, of course, there's some major change to its health status. It doesn't look like it's doing well physically. And so they can just live their lives and not be stressed with repeated trapping.
So from a veterinarian professional here, tell me, is it true that in Washington State or our area that female cats get clipped on the right because girls are always right?
That's actually true nationwide. Yes.
Nationwide.
So it's very easy
You
to
heard it
remember.
here.
Girls are right.
That's right. Females always right, so we ear tip them on the right. Males are ear tipped on the left. And that's handy as well when people are counting cats to quickly be able to put down the sex of the cat as well as their location. So it serves a purpose as well as it's a nice, fun inside joke.
You heard it here, folks. It's
From the professional. Granted, we are
subject
just
matter
a bunch
expert.
of females here on the podcast. So sorry, fellas.
That's right.
Well, and that's something that we do here for the cats that are adopted out as barn or business cats as well. So if someone adopts an animal or a cat from us that is one of those semi-feral or completely feral cats that they get to help with maybe vermin control around their property or something like that, they'll also see that they're ear tipped.
That's right. And sometimes there are cats who have an ear tip and they are actually completely friendly, and several things could be going on there. They may have declared themselves to be friendly after they received their ear tip.
Yeah.
And sometimes they do decide to change their minds about what they're comfortable with. Cats are very sensitive to the environment they're in. And so we may have initially thought that they were feral, and then they later let us know that they were not. Or sometimes people have brought cats in to take advantage of free spay and neuter programs and maybe declared it as feral when it wasn't, and the price of that was an ear tip. So if you see that, regardless of how the cat's temperament is, it does mean that it's been cared for and has gone through a program like that.
spay neuter. That's awesome. Thank you for
Yes.
explaining all that to us. And so we want to chat a little bit about how the mobile unit could potentially be used for overflow of space for in-house animals, and why that's even something we have to think about.
It's very relevant right now.
It is very relevant. So one of the biggest limitations we have here at the Humane Society is our space to prepare and recover animals from surgery. We actually have 2 surgery tables, and if you've been down to our surgical suite, you've seen that what we do is we load one surgical table and have another table with an animal on it where the surgeon's working, and then that surgeon can move back and forth between the tables to keep them busy. What we lack largely in our surgical area is the space to actually have more animals under preparation for surgery and recovering from surgery, particularly with larger animals, so dogs, but just simply sheer number of animals total. So even though we have surgeons on staff that are capable of doing 50 cat surgeries in a day, we don't have the holding capacity or recovering capacity to actually move that number of animals through without expanding our physical space. So we can imagine using this mobile veterinary clinic to perhaps be sitting right outside where our surgical services are happening, where animals can get prepared or prepped, as we say, and then recovered in a as clean and hygienic and temperature controlled environment
and calm.
That's right, and
keeping it
calm
a calm
and be
environment.
observed. So it physically expands our space for moving the number of animals through surgery that our surgeons are capable of. There's always a bottleneck somewhere in the process, and so you might have 2 of the 3 things you need, but that one more factor is what's preventing you from doing more.
Yeah.
Oh, and we can't adopt out animals either until they've been spayed or neutered first. And so even just for general adoption purposes of making sure the animals aren't here any longer than they have to be, that will be really great.
That's right. And so we definitely want to help animals move through the shelter as quickly as possible, or to come out of foster and right into new homes as soon as possible. So we always prioritize animals that are adopted or are being returned to their owners that can get spayed and neutered. But if we have even more capacity, then we can do some ahead of time, even before those pathways are identified for them. So they're really ready to go right on that same day.
And we've said this multiple times on the podcast, but the shelter is not the most ideal environment for any pet, and we want them in a loving home as soon as possible.
Having more spay and neuter options for people is definitely only going to improve people's ability or likelihood of getting their animals spayed and neutered, because even though we have our voucher, even though we have our voucher program, and other places like other rescues even offer low-cost spay and neuter resources, places are getting booked up, and it can also be really hard for some people to get an appointment. It's just everybody's kind of, all of the people that want to get their pets spayed and neutered, it's great, but the demand is hard to keep up with.
Yeah.
That's right. And in the veterinary space, we call that access to care. And that's sort of the buzz phrase of the moment, and probably will be for a long time. So I think we're all familiar with finances being an access to care issue, right, causing a barrier. But we've also talked about the fact that transportation is a barrier, but availability of appointments, regardless of how much money you have, is also a barrier to access to care. And so just simply providing more opportunities for those services is removing one more barrier. And
the need in Pierce County is just, because Pierce County is so large, the need is there. And like you said, we have Northwest Spay and Neuter down the road. We have Posados that has a mobile unit that comes to Pierce County. But the need is definitely there for expanded services.
That's right. There is an estimated 130,000 community cats in Pierce County alone, and that's done with kind of counting algorithms to give the best estimation. And so you can imagine how many surgeries per day that would take to make a dent in that. And so the concept is not that you're going to do all of that overnight, but again, through a targeted approach, that you're going to reduce the areas that have the most cat colony populations to really get those back under control to where they're manageable and they're not spreading disease and they're not unhealthy. So we are looking at meeting the needs of Pierce County where they are greatest through the targeted TNR programs, and that will have a ripple effect to all of the other things we get a request for. For example, we all probably know that we're in kitten season right now. I know our foster team is really feeling the strain of that as they struggle to place kittens every day.
We had them visit us on our podcast.
That's
yes,
right.
That was a big need.
They're amazing. They're amazing, and they do a great job at making those connections happen. But one of the things that's happening in animal sheltering is a changing of a lot of the narratives that we used to have over time. Many people still think that the right thing to do when they find kittens, for example, is to bring them down to the shelter. And that's really not the case. We really want you to evaluate the health of them and the age of them and the location, because many times they're waiting for mom to come back. They're fine being cared for where they are. Cats are very resilient. And so changing the narrative and the education piece of that is also going to be a huge part of what we can do through outreach on the Mobile Veterinary Unit.
Yeah, that's what we're trying to do little by little, even with the people that come to our pet food pantry. Some of those are owned animals that they're trying to feed, but some of the people that come, they are also supporting some community cats as well, and so they're in need of food for those because they don't necessarily own them, but they've kind of taken on some sort of ownership, their care for them, and making sure that those don't create more mouths to feed is really important.
That's right. We're going to feed them whether they come in here or whether we send food back to the caretakers to feed them in the field. And I'd much rather be feeding them where they already have community and where they're already established and they're not stressed out and they're not here waiting for new homes. Mm-hmm. So the theme really is to support animals where they already have community.
Meet them where they're at.
Mm-hmm.
Yeah. And thank you so much for sharing all of your knowledge with us. Subject matter expert over there. So Dr. Bennett, this is a huge endeavor that we're taking on as a shelter, and I would love to know how we're going to make this happen.
Mm-hmm. Well, I mentioned what the Mobile Veterinary Unit looks like and that it comes from a company in Ohio. They're not inexpensive. A unit like we described costs about $316,000.
Ooh.
Right. That's the cost of a house for many folks. And
not in Washington.
Not in Washington, maybe an apartment.
Yeah.
We're very thankful that we've had some starter gifts for that unit, and we are about halfway there. So we are going to be looking for the community to help support us acquiring the rest of this vehicle through any kind of small or large donation that is possible. Everything contributes to the life-saving work that we do here and all of those ways that we intend to use this vehicle. So you can definitely make a difference in helping us purchase this mobile veterinary unit and make it a reality for our community. And you can find ways to donate on our website, which is thehumanesociety.org/MVU. And your donations will go to support the mobile veterinary unit, but also help us set up the programs to help control the community cat populations through our targeted TNR efforts.
Yeah, if you are listening and you hear about TNR and want to make an impact, want to get involved, this is the way to do it.
Related to making this possible, it will be able to help cats such as Tiny Little Squeak, for those of you following his story.
Yeah, we're entering our segment of how we made Happy happen this week.
And this is a really good little happy thing.
Yeah, we love Squeak.
Yes, so Squeak was a tiny little kitten. I think he was only like 3 or 4 weeks old, maybe.
Yes, still a neonate, as we call them.
Yes, and he's all white, just this little puff, but the Good Sam found him in their yard, and it was kind of known that there are community cats in that area. Mm-hmm. So they saw that he was injured, and if you've seen our website at all or our Instagram posts, it was a pretty significant injury for such a tiny little baby.
That's right. He had some kind of a wound on his right side of his abdomen, I believe, and we don't really know what caused it, but it was quite open and gaping. And even something that looks maybe simple like that can really drain a little kitten's resources. They can get dehydrated and they can really not grow and not thrive with a wound like that. Mm-hmm. And he really represents a lot of our community kittens that are out there, which overall we hope to reduce the numbers of, right? But he needed additional support.
Absolutely. Like that picture is pretty shocking. And so he was brought in at the end of May, and through his foster taking amazing care of him and the vet team offering treatment, like, wasn't there light therapy? That's
right. We have a really cool device that we have incorporated into our treatment this year. It's called Fovea, and it's a light wavelength therapy that actually serves to stimulate different cell types to come in and help clean up and heal and fill in the gaps. So it's used for a lot of inflammatory conditions and skin wounds, and it's quite effective.
Yes,
I guess so.
It very much is. I think the foster posted, and it's completely closed. Mm-hmm. Like, the wound isn't a big, it was a large hole, especially for that little body.
And it's only been about 3 weeks.
Yeah, not even a month. And he looks so good, and he's fluffy, and I guess he's thriving. I heard that he was going to get some other foster kitten siblings because he was found just by himself. Mm-hmm. So he'll get to have some kitten time and just focus on being a happy, healthy baby now that that wound is healed up. And
that's right.
The fosters did their part, the vet team did their part, and now he'll end up being able to find his happily ever after in a new home.
And you can, like, hear our smiles in our voice
now. The pictures were just amazing.
I know, and it's such a cute little kitten.
I mean, I love cats anyways. I bring up cats every time.
No matter how many
no matter what our topic
is,
I bring up the cats.
That's right. Well, a lot of people, when they hear you're a veterinarian, they always think, oh, I want to play with kittens too.
Not it.
And as you guys know, that is not necessarily the bulk of our day, but when we do have an opportunity to do that, it is really, it refills your cup.
It's refreshing.
It is.
Absolutely.
Well, thank you, Dr. Bennett, obviously, for joining us today. And we thank you all for listening.
We post episodes every other Thursday, so come back and listen soon.
If you enjoyed this episode and you'd like to support the podcast, please go ahead and subscribe, share it with others, leave a rating and a review. And if you have any questions that you want us to answer on a future episode, go ahead to our website, which is thehumanesociety.org/podcast, and submit your questions. And to catch all the latest from the Humane Society for Tacoma and Pierce County, you can also check us out on Instagram and Facebook at Tacoma Humane.
See you next time.
Bye, guys.
Thank you.